evening. I'm Barbara Stillman from the League of Women Voters. Welcome to Let's Talk Issues, a public service program sponsored by the League, the Kansas City Star, and the Johnson County Community College. Tonight's program is on poverty in Johnson County. Our moderator is Candy Birch, who will introduce our panelists. Thank you for joining us, and now let's talk issues.
Good evening. I'm Candy Birch of the League of Women Voters, and tonight we're going to talk about the issue of poverty. Johnson County is commonly known as the wealthiest county in the state. I looked up the 2000 census and found that Johnson County ranks 43rd in the nation in per capita income. Our per capita income was nearly $9,000 over the national average of $21,500. In addition, we have the median household income in Johnson County. In 2000, it was almost $70,000. We were the 19th richest in the nation. The median household income in the nation is $41,000, nearly $42,000. Again, Johnson County ends up being about $27,000 above the median household income. Yet, despite the wealth in Johnson County isn't immune to the issue of poverty. The poverty rate is growing in Johnson County, and with the economy in its current crisis, poverty is rising even more precipitously. While government and human services organizations have traditionally dealt with what Ruby Payne called the generational poor, or those who are chronically poor, a growing number of individuals and families have been thrust into what might be called situational poverty due to a myriad of circumstances, economic factors that present even greater challenges to the support systems that we already have in place. I've been on the poverty committee at the League, and we're studying poverty, but I am not the expert. And so I'm very excited about the fact that we have 4 guests here who are very knowledgeable about what we have here in Johnson County and in the state of Kansas. And so I'd like to introduce to you our 4 guests. First, we have Valorie Carson. She is with United Community Services of Johnson County. There she is the Community Planning Director. She's the facilitator for the Johnson County Continuum on Homelessness and the Drug and Alcoholism Council of Johnson County. She has been with the United Community Services, UCS, for over a year. Secondly, we have TAMRA Brandis. She's with Catholic Charities. She's the Director of Emergency Assistance. She's been with the Catholic Charities for 6 years. With a master's degree in social work, she's had experience in the field for nearly 15 years. Third, we have DOLORES FURTADO, Kansas House of Representative for the 19th District. This is your first term. You are serving, if I'm understanding correctly, on the Health and Human Services Committee, the Aging and Long-Term Care Committee, Economic Development and Tourism, and Arts and Cultural Resources. A former Johnson County Commissioner, so you have a colleague there beside you, and a retired professor of microbiology at KU Med Center. Thank you for being here. And last but not least, Mr. Ed Peterson, Vice Chairman of the Board of Johnson County Commissioners. He has represented the 1st District since 2003, a former mayor of Fairway and city council member before that, chairman of the Mid-America Regional Council Air Quality Forum. Is that correct?
That's correct.
Okay, and welcome. Thank you so much. So let's talk issues. Let me start, Ms. Carson, with you. Tell us a little bit. I will tell you that a couple years ago I went to the first general meeting or an annual meeting of the UCS, and I think United Way was there at the time, and they presented this wonderful presentation. I got this book at this time, and I've used it so many times, talking about what are the human service needs in the county. It was just seemed like everything that we could possibly ask for. But because I didn't know at that point even what UCS was, could you give us a little idea of what is United Community Services?
United Community Services is a 42-year-old community planning organization that basically brings together a broad variety of organizations from across Johnson County that are all committed to addressing the need for different types of human services and to help facilitate and get them to work together in a way that benefits the most people in the community, but especially those who are most vulnerable.
Okay. All right. Then let's talk a little bit about, I know that one of your specialties is pulling together all of the data, and they're very powerful statistics that you can give us. Tell us a little bit about poverty in Johnson County.
Okay. When we talk about poverty or those who are poor, we're talking about, often people are using different terms. And so when we talk about the federal poverty level, those who are in poverty, we're talking about people who are, for example, a 3-person family are making about $17,600, at least for 2008. And in Johnson County, there are 22,000 people who meet that criteria of being at 100% at the federal poverty level. But we also talk about those who are low income, those who are struggling and are the working poor and are at 200,000 or less of the federal poverty level. And that is a much broader group of people, over 74,000 in Johnson County currently. If you think about those who are poor, who are in poverty, 50% of those are 24 years of age or younger. And that's disproportionate, as that makes up only about 33% of Johnson County's entire population. So you are more likely to be poor if you are young in Johnson County.
And on either one of those levels, the actual low income, which is 17,300, I mean 600, or the 200% of that poverty level.
At both 100 and at 200%.
Right. Okay. All right. So how much has that rate of poverty grown over the years?
Well, if you look at the census at 2000, and you look at the 2007 American Community Survey, which was a sampling and it was then extrapolated for the rest of the population, you see that Johnson County is growing at about a 14% rate. But the level of those who are in poverty is actually growing at 2.5 times that rate. So much faster, and so that's of concern.
Okay, just did the math, 35% growing. It's growing that fast.
If you're going at, actually you're at about 14%, and so you would jump to about 44%.
Okay.
Yes.
All right. So growing rapidly, the rate of growth. Ms. Brandis, I can call you Tamra. I believe, I'm not sure, but tell me, is Catholic Charities a part of United Community Services?
Absolutely. We're
That's
so
what I thought.
Yeah, so we're closely with Valorie and the Continuum of Care on homelessness, just in one of the ways that we work together. And they do a fabulous job of bringing us all to the table, sharing information and resources so that we're better able to serve our population.
Well, tell us a little bit about Catholic Charities. I know that many people do know, but then there are people who don't know exactly what are the responsibilities and what does Catholic Charities do.
Well, I'm grateful for an opportunity to talk about what we do. A lot, because I think what you said is true. Many folks see Johnson County as a place of affluence, and we see the folks that are the working poor, folks who are working service industry jobs. That are living sort of at the level that Valorie mentioned. Most of the folks that we see are at 150% of poverty or below. So if you think about that for a family of 4, they're earning about, what is it? I can't remember. $2,500 a month before taxes.
$2,500 a month.
$2,500 a month before taxes. Almost $2,600. So that doesn't allow for a lot of latitude if something goes wrong. And I would say that at Catholic Charities we serve about 4 different groups of people. The largest group by far are families with children. And usually they're headed by a single parent. And they're typically working a job that doesn't provide benefits. In other words, no sick days, no vacation days, no benefits in those ways. And so if the Honda breaks down and the baby gets sick, all in the same pay period, and you had to miss work to go get your child, and you had to pay $200 to get the car fixed so that you could continue to get to work, you can quickly find yourself with $20 in your pocket. It's Tuesday. Don't get paid till Friday cupboard's getting bare, rent's due. What do I do? So that's the largest group of folks that we see, are folks that something has gone wrong. And I don't know about you, but I mean, I can't go a day when something happens that I didn't plan for. And at that level, when you're working a job in that doesn't provide those kinds of benefits, it just doesn't allow for any wiggle room. And so that's the largest group of folks that we see, and they don't usually come to us unless something's gone wrong. Another group of folks that we see, and we serve them because we should serve them, are elderly and disabled, folks who are living on a fixed income. So let's say you're living on $721 a month, and it's Christmas, and you'd like to buy a gift for your grandchild, that's still $721 a month. Let's say somebody gets sick, and some of the new medicine isn't covered by your insurance. So there's those kinds of things as well that can happen. And so we should serve those folks, and we do. Lots of times when we're interacting with them, it's less about increasing your income and decreasing your expenses. It's more about talking about quality of life issues. One of the things I am most proud of about Catholic Charities is I think that when we meet with folks, though what we are providing is emergency assistance, and in essence it's crisis intervention, we try to sit down with folks when they come in and engage on a more human level to try to visit about what makes sense in terms of what can we do to help. So we're not just handing them tuna and saying, I hope that changes your life. We should do that. Tuna is a start. And I'm grateful for the folks that donate to our food pantries. I think for folks who are in need, that's probably the easiest thing to ask for. But at our agency, I don't think you have to check your dignity at the door in order to ask for assistance. I think that we do a good job of sitting down with folks and visiting about circumstances and then going on about the business of trying to do everything we can to help. Another population that we serve are folks who are not well. I know it's hard to be politically correct and say this sensitively, so I just want to be careful. Those folks who are maybe not diagnosed or not on medication that could help them to function like you and I do on a day-to-day basis, folks that are just there, they belong to someone. They're someone's daughter, someone's mother, someone's sister, but for whatever reason, family or friends have not been able to help them to access those kinds of resources. So those folks come to us. And I'm really proud of the way we interact with them. When the primary presenting issue is a mental health issue, we try to make appropriate referrals. I think that's one of the great services that Catholic Charities provides, is our case managers are well equipped with knowledge about community resources and can make appropriate referrals in that way. But to listen to a story is a huge step to start. The last group of folks that we serve are families who are homeless. And I know folks just think, that can't possibly be happening in Johnson County. And it doesn't look like it does in the movies. In the movies, the homeless person is maybe sleeping in an alley or on a street grate or hanging out under the bridge. Or in our community, it doesn't look like that. It may look like there's a mother at nighttime doing laundry at the laundromat, but if you look closely, her little child is asleep by her side. It may be that car or van that was in the Walmart parking lot, and I was just here the other day and that same van was in that same spot. It may be because a family is trying to be safe and that place is open 24 hours. So obviously they're trying to be mobile in that kind of circumstance. But we serve about 100 homeless families every year. 6 years ago, when I came on to Catholic Charities, we were about 80 families a year. That number has increased. And we do strengths-based case management with those families, helping them, again, to engage on a little different level. It's not so much that we're baiting them with, if you do this, this, and this, we'll help you in this, this way. It's partnering with the family to try to figure out what's best, what can we do to help you.
I had no idea that there was so much that Catholic Charities can do and has done. Thank you for that summary. Okay. I'd like to turn now to, again, Johnson County, Mr. Peterson. I know that you have a great deal of information about what kinds of things Johnson County, the government, does for those who are in need, and I was hoping maybe you could give us a little inner overview, I guess, really, of what is it that the county can do for people in need.
The county is the provider of last resort in many instances. There are 3 or 4 general categories that the county engages with those who are economically less fortunate. First would be health and humans. In our health and human services area, we have a housing and aging department, and as the name would suggest, they deal with individuals who have issues either maintaining or entering into the home situation, having a place to live. Within that, we provide a weatherization service for low-income people, and that's a program that we'll probably want to talk about later in the context of the stimulus program. We provide a number of aging services ranging from Meals on Wheels. We have certain transit services for aging. We have just contact programs with aging, and so all those would be within the Human Services and Aging Department. Second department where we provide an extensive range of services is in our Public Health Department, and that has 2 functions. One is to serve as kind of the public health agency for the county, but probably the broader set of programs fall within our just health services to low-income and needy people. Those programs include just basic visits. We have the WIC program, which deals with pregnant women and children. We have some pregnancy programs that are designed to try to address prenatal issues. Both the WIC program and the prenatal program have had great benefits in terms of reducing the long-term health care costs to the community. Then the final area where we do a fair amount of low-income services is in the area of mental health. We see about 500 new individuals each month on average, closer to 600 now. It's on the increase. Most of those people have either mild to severe mental illness, and they have no way of affording the services. Some of these are individuals that require care, both for their safety and for those around them. So that program, again, is a very important program that reaches out. And then finally, we have a program for developmentally disabled individuals. And again, the vast majority of those are individuals who would have no care in this field other than that's provided by the county. We deal principally with adults, and during their early years, there are other programs available to them, but as they reach adulthood, the county is the agency of last resort for those who don't have the means to afford private care.
I'm just asking you this kind of out of the blue. Do you have any sense of how many people is just in general we serve in the course of a year, or is there a percentage? I guess really I was looking, I didn't know if I could find anything.
One of the interesting anomalies about Johnson County is that although the poverty rate as a percentage number is fairly low, it's about 4%.
Yeah.
But when you translate that into numbers in a population of 525,000 people, you have the numbers like Valerie indicated earlier. And in fact, Johnson County, in terms of just numbers of people to be served, is about the largest county in the state in most of these categories. And so, although our median income is deceptively high, the number of people that have to receive services is quite high, much higher than you would expect. And I think the other thing is that we attempt to provide a very high level of service here. And in turn, perhaps that drives the need for money and employees as well.
I agree that high quality is kind of what Johnson County has become accustomed to, and we want to do that for those in need as well.
Yes.
Okay. Thank you for that overview. And now we go to the state level, and it's been kind of exciting in these last few weeks. And so I know that it's going to be very difficult to, just to transfer and shift only to poverty, because I'm sure that there are other things that are on the agenda right now. But Mrs. Furtado, can you tell us what it is that that the state can, what can we expect from the state?
The state serves its vulnerable residents through three main areas: health, nutrition, and residential services. And these are provided by three main agencies: your Kansas Health Policy Authority, SRS, or Social Rehabilitation Services, and the Department of Aging. There are a lot of minor transfers made, but those are your big agencies. So with respect to the Kansas Health Policy Authority, their charge is to oversee and administer managed care, fee-for-service, track all the data for the state with regard to wellness or illness, and then do the compliance. We have to adhere to federal rules and regulations. So the programs that you hear about include S-CHIP is the national term for the children's insurance, health insurance program. But the state here, we call it Health Wave. But this is a matching fund where 72% of the dollars come from the federal government and 28% is matched by the state. Then we have Medicaid, and that we know and have heard about. Low-income individuals, poverty level being the standard, the federal poverty level. Then we have, among these, pregnant women that fall into the needing prenatal care. 40% of the babies born in the state are on Medicaid. So we have a lot of poor babies. We have many disabled, and then the elderly. So Medicaid is your the match there is 60% for the federal government, 40% for the state. And when we talk about the stimulus, I will tell you how that may change. That will change a little bit. The important thing to remember about federal dollars is they do have the requirement that there's a match, and that they have to serve a defined population, provide some very defined services. And now smaller programs that the state has, a program called Medican, which is to provide services for young people under the age of 19 that are not eligible for Medicaid. They've had a little bit more money, working poor. They're going to be the individuals that will get this. Very low income adults with children. And that income has to be less than 30% of the federal poverty level. So this is low. They get some help from the state. If you're an adult without children, we can't give you any help. And we're hoping to in the future, but right now that's not helpful. Then we do screening programs, the usual cancers and as such, in collaboration with the Department of Health and Environment. So here's another area where a very special little program gets funneled off. And then we also have school programs that stress health, be it smoking or be it obesity and exercise. We're trying all those things. And that is being done throughout the state in a slow but increasing increment. And we're hoping to see that. So therefore, we have KHPA, or the Health Policy Authority, which will monitor efficiencies and quality control. They have a lot of responsibility. So you might ask, who's watching them? Because they've got a lot of money to handle out, and it's your Inspector General, okay? So that takes care of health, pretty much. When we come to nutrition, SRS has the Food Assistance Program, which is federal funded, but they have to identify, again, the criteria there, you just hand it out. And then there are general assistance for the disabled, and these are things such as residential care, needs for services, transit, whatever. And so we have general assistance for the disabled. Then we have temporary assistance for needy families. That's a block grant that the federal government gives to the state, and then the state divvies it out to the counties. The county and the state are very much working together. Lots of the funding that goes to the county is in grants or block amounts, but the county's contribution is a lot in the personnel and the buildings and all that. So it's a partnership, and a very valuable partnership. The residential services for the disabled, we have, of course, institutional people who live in homes or nursing homes for the elderly, and those are, again, often on Medicaid and with a lot of extra help for the disabled. And then waivers, you hear that talked about a lot, the waivers. And the waivers are to provide community-based help. And so that we remove people from institutions, keep them in their homes. It costs far less, only 1/3 of what it costs to be in an institution. And it is, of course, a better quality of life. Now, there are issues there because caseworkers who work in the institutions get paid better than those who work out in the community at this time for the same kind of work, and there's a lot of tension there, and something that we hope to address in the future. Then finally, aging department. You hear about the frail elderly, and the frail elderly are folks who are on Medicaid, and they can be in nursing homes or they can be on waivers for community-based services. And again, we get back to the caseworker situation and the tension there. And then finally, we have people who are on Medicare, and they quickly deplete their assets and move into Medicaid. And so we have those kinds of challenges with respect to the investment or contributions by the state to its residents. That pretty much gives you the broad picture of how the state is involved. And I didn't focus so much on the dollars. We can talk about that later.
Right. It sounds like there are a lot of services there, and when we compare Kansas to other states or neighboring states, are we proud of the amount of service and the delivery of services that we have in this state? I mean, are you feeling comfortable that we are?
Yes, I'm comfortable in that we do go after grants, and we do try to obtain as much of the federal funding and try to match it as well. Now, with respect to Medicaid, we are very restrictive, and we need to broaden that, but that will require more dollars. I gave you an example of the very poor who we have some assistance for at 30%. Well, if we went up to 100% poverty and applied it, not eligible for Medicaid, but in our special assistance, we would have 30,000 more people eligible for that assistance. And when you're talking about the kinds of money that you need for that, it rapidly gets into the millions. And so these are the challenges. But for what we have, we are doing well. And I think an area that we've improved tremendously is in mental health and delivering community-based services to people on Medicaid. And now we need to expand that to the community-based services for your low income and for those who need it, period. And so there's a lot of work there, but it is improving.
I think I read in the paper, was it just this week that they passed, or they were deliberating on the minimum wage. Is that still in progress, or has it?
Yes, the Senate has passed a bill that would raise, the Kansas minimum wage today is $2.65, and there are 20,000 people. That's what they earn per hour. And so the minimum wage for the nation in July will grow to $7.60 or 65 cents. And the bill passed by the Senate, sponsored by Senator Francisco from Lawrence, is for us to achieve the national minimum wage September 1st. Now the bill has to come to the House, and there is going to really have a long debate, and I would not predict the outcome because the House, the Senate has 40 people, and they can sometimes work better together than when you put 125 people that have to work together.
Yeah, okay. I didn't know if it had gone anywhere today or...
Not yet. No, it hasn't surfaced on the House agenda yet.
Okay. I guess one of the things that I just don't want to get too far away without talking about the thing that's in the room right now, the elephant in the room being the possibility of stimulus. And I know we have some other things that we can talk about, but I thought perhaps we might go that level and then come back to some of the services again. I'm very interested in what prospects we might be thinking about as far as the stimulus package, because I definitely don't want to. I want to give that as much time as we can. I was just looking at one. I think it was this week. We saw a graphic in the paper that had the number of foreclosures in houses in Johnson County, where it's gone from like 200 in 2006 to over 1,800 in 2008, and I know that there are all kinds of things that are happening here, and I'd be interested to know where. I don't know whether to start at the state or start at the county level, but maybe we'll start at the county level. Talk to us a little bit about what might we looking forward to if we get a stimulus?
Well, there's certainly a wide range of areas that are going to be impacted with the stimulus, but to focus on those that might affect the subject at hand here this evening, one that we are particularly excited about and taking a hard look at are energy development block grants that are part of the stimulus plan. These, in essence, or in actuality, are funding an energy block grant program that was passed by Congress 2 years ago. It has $3.8 billion nationwide. About 68% of that is designated directly to communities with 200,000 or more in population. So we stand to get a significant amount of money for this purpose, and it's to be used for alternative energy and energy conservation. We hope to be able to use those funds to make a significant impact in development of enlargement of our home weatherization program. We're hopeful. We currently spend about $1 million a year on that. We'd like to at least double that. Mm-hmm. It does require some additional staffing, but the funds could be used for that. There's no local match that's required. So that is one that we're particularly excited about, and that's one that's coming quickly that we're going to have to move quickly on. We're working with some other communities in the area to possibly leverage our program with others so that we maximize the impact in the region. On top of that, then there is a very large pot of money out of the stimulus package that is dedicated to human services, health and human services. We have just begun our look at that package. Most of those programs don't have quite the quick time frame on them that the infrastructure and energy programs had. And then finally, there's some transit components to the stimulus package which we may be able to utilize to expand our programs like Share a Ride or the Easy Ride programs that serve essentially elderly and sometimes low-income populations in our community. So those are three significant possibilities that we're presently working on. I'm sure there'll be others.
When you talk about energy conservation and weatherization, can you be really specific about what kinds of things that would happen to a home in that kind of thing? I mean, what are we talking about? Changing windows, or are we just at? I don't know what we're. Well, when we talk about a program,
I think it would, in most cases, include audits, but certainly we would target the types of measures that have the most significant impact on a home. At least that would be what we would pay for. Certainly a homeowner would have the option of going farther with their own resources. Mm-hmm. Those include things like new windows. Interestingly, attic insulation is the most bang for the buck measure that we've identified. And windows would be another one. Weather stripping and so forth of doorways and other openings would probably be the third most prominent. So we would focus on those. Our current weatherization program includes an audit and then follow-up with the measures that are identified there, and that would be what we would build upon to move forward. Our hope would be to reach more homes as opposed to expanding the type of services that we offer.
Okay. Thank you. stimulus at the state?
At the state level, the stimulus package is, of course, a very valuable source of monies that will see us through this difficult time. However, I'll emphasize that the federal dollars come with some rules, and the key word is sustainability. We must be able to sustain the services or any of the programmatic things that we do that are going to go into the future. So that's why you have in two categories. You've got the shovel ready, that is the language being used over, and what that means are projects that they can go. So what kind of state projects do we think will be a go? Well, obviously transportation, roads, infrastructure. That is a very big possibility. The universities, you've heard about the building maintenance. They had much that can be done as a one-time thing that would sustain for a while. And so those are important because if we can use the federal stimulus dollars, that may free other dollars that we can then use to do the sustainability. Now, with respect to the topics we're talking about tonight, poverty, the important thing with the S-chip is that more children in Kansas will be under health wave. And so we will have that good care that they need to have a good start. Secondly, Medicaid. This is exciting. The federal government will increase its contribution to 66 cents on the dollar, 66.2 to be precise, and the state therefore matches that difference. So what we have there, instead of 40%, we're coming down to 34.8 or 30 so, and there, that extra 6%, when you're talking millions of dollars, gives you enough money to stabilize that fund and that activity, and so we look forward to that. Now, with regard to the schools, education is eligible for much of the stimulus money, but again, directing our interest to those that we're talking about tonight, we have the free lunch, reduced lunch programs. They may be able to get more support through the nutrition block grants and other monies that we can competitively go for. So there will be some monies that will come that they're just divvying it up among the states based on the record. Then there are block grants that you can apply for and get, and then there will be grants, competitive grants, and there'll be extra money there. So we should see this. The people who came to testify about the disabled pointed out that if the monies are funneled to the disabled, they would be able to hire a lot more social workers, caseworkers, to go to visit them in the homes, bring up the salaries. That will make more economic benefits to that community, and so we have a ripple effect or a growing effect. And so there are all kinds of strategies, but right now the task force that is looking at it is headed by Lieutenant Governor Mark Parkinson, and there are legislators on it as well as community leaders and that are going to come up with a plan, because we do need to keep in mind that the federal government has stipulations that must be followed or else it will go away.
Valerie, a number of the agencies that you that are under your umbrella, depend on these kinds of aid, this kind of aid. What do you see as that might be a benefit to our community services and human services here? I mean, do you see anything that's coming your way, or do the agencies see things that are coming their way?
Well, and these are actually things that are separate from the stimulus package, which I don't think has been so clearly defined down into the human service area. Though I am interested in knowing about the student lunch program that could serve more people, because already over 14,000 children in Johnson County actually benefit from free or reduced lunches, which is almost one in six. And so that would be good, because for some children that is their solid meal of the day 5 out of 7 days of the week, so that can make a big difference. Johnson County was the continuum of care on homelessness was just awarded almost $380,000 for transitional housing and permanent supportive housing and supportive services. So hopefully that will bring additional programs in for those who, for those, like for places like Salvation Army, for Catholic Charities, for Johnson County Mental Health, to help those who have mental illnesses or disabilities that then put them at risk for long-term chronic homelessness, and give them a place where they can stay, that they get supportive services on a long-term basis. In fact, Catholic Charities just got one of the 26 pilot programs across the entire United States for a rapid rehousing program through that grant application, which is very exciting and is hopefully a demonstration project that will help those families that have children who become homeless to, instead of having to go through a very long and protracted, kind of shelter to transitions, trying to figure out and get their different kinds of supportive services like training, taken care of before they can get into their own houses, will actually help them go straight into a permanent housing situation so that they have a strong base from which their family can then get retrained or get healthy and be able to become economically self-sufficient again.
And tell me again where that grant came from.
That was from, I'm sorry, the Department of Housing and Urban Development.
Okay.
And that's something that we apply for every year as a continuum for Johnson County to bring those monies in.
And is that a larger grant than in the past, or is this something is this the first time we've gotten that grant? Or
we do this every year since we have applied in I don't know my dates here for sure.
So I'm talking about sustainability.
But
so we're
these are some things that we're doing every year, yes, and we're being able to sustain those programs that are already existing. And this year was exciting because we were actually able to capture money to do new programming, which is something that we hadn't done for a couple of years. And so we're very excited about that, and then we'll hopefully be able to sustain that too.
Back in January, I went to a meeting that is at UCS, and one of the speakers was Kevin Yoder from the state legislature, and talking about difficult decisions that were going to be made. But the other person was, I think Brenda Stokes was
Brenda Sharp.
I'm sorry, Brenda Sharp, and she was talking from as the CEO of the REACH Foundation, and she had some interesting things to say about foundation money and that kind of stuff. I don't know if you were there at that meeting, but I was interested in the fact that she was speaking to a group of human services providers, a good number of them in the room, and her concern was the fact that not only was there perhaps a lessening in the amount of money that would be donated, but also that the portfolio that sustained that foundation was losing money because of the economic downturn. Is any of that affecting? How is that affecting the organizations that you serve? I mean, the foundation money, are there fewer grants, or are we keeping our donation level at the same rate?
Well, let me kind of speak in general, and then let you speak in specifics.
Yeah.
My understanding from what Brenda said, and from some of my conversations with other people at other foundations, is that in general and across the United States, many private foundations probably lost on average between 40 and 45% of their assets holdings in the last part of 2008. As a result, and you can drop really fast, but the amount of time it takes for your assets to rebuild themselves over time, even in good economic times, is an extensive amount of time. And so in general, what we hear is that it's a terrible crunch because they have less money to give out because they have to be sustainable in a long-term basis. And so they can't give out so much money that they put themselves at risk for the community in the future. But at the same time that they're having 2 to 3 times the number of applications from organizations for those grants cycles that they normally have, and then in addition for what they call applicant-defined types of grants, where people are coming in and saying, I had this special situation, can you help us? And so for them, it's a really challenging time because this is they're called to serve and try to make a difference and assist the community from which they come, and they're crunched for money, and they see the need increasing. But you could maybe speak specifically to how that affects organizations.
At the community level, the interesting thing I think we're seeing, and this is, I think, probably a reflection of what's going on with the stimulus package and things of that nature, we have had foundations, private funders, actually contact us. And you know how if you speak about federal funding, state funding, you automatically have to bring up sustainability. I think the interesting thing is that these private funders and foundations are now more willing to consider emergency assistance, consider that type of intervention. I hope that they consider Catholic Charities, because we're doing a case management model of providing that kind of assistance. So we're trying to provide some follow-up and engage on a little more involved level. But it's been very interesting that we're involved in a metro-wide database called MacLink. It just allows us to provide some aggregate data to funders. And I think that's been significant in allowing folks that have money and want to impact this difficult scenario that folks are living through right now, and has provided them an opportunity to say we would like to fund emergency assistance. And looking at, it's not so much focused on sustainability in that, how do I want to say it? It's just more focused on if we can intervene before things get to deteriorate into a crisis where families become homeless. It's just, in my mind, it's a reflection of what's happening in the larger community, that on our level, folks want to see us continue to do the work that we're doing to try to sort of be a safety net for families.
For some reason, that just does not surprise me. I believe that Johnson County has always been a very giving kind of community. I have a sense that the citizens in Johnson County have a sense that quality of life means taking care of all of us, and I'm very proud of the fact when I look at just the agencies involved in these kinds of organizations that we are thinking about not only how do we help those in emergency need, but how do we even help them to help themselves later. I mean, I'm looking at, I'm thinking, even right now in the legislature, they're talking about financial literacy and how do we learn how to be better stewards of our money when we have it, and that kind of stuff. So that does not surprise me in many ways. What are you seeing? I read an article a little while ago about how successful our Feed the Need in the county is, and how wonderful that is. I know that there are more and more demands on that and more requests, but what are you seeing at your level, at the Johnson County Commissioner level, that speaks to the generosity of our...
Well, I suppose the Feed the Need is a good program. It's a voluntary effort that's done by our 4,000 workers that are employees of the county, and we raise over 100 tons worth of food. Does that number sound right, Dolores? I think it is. And that all goes into local food pantries and organizations like Catholic Charities. You know, interesting. I think the stimulus presents somewhat of an irony for us in local government. We're having funds come from the federal government to assist us in certain projects that we're hoping to be able to expand or develop, and it's there to create new jobs, the stimulus is. At the same time, because of the economy, the demands for our basic services are increasing, and at the same time our revenues are declining because of our reliance on the real property tax. The foreclosures and so forth result in lower appraisals and slightly lower tax revenues. And at the same time, the state is going through a severe economy situation, which in turn forces them to look at programs. And the programs I see that tend to get on the chopping block first are those which are not emergencies, those which are preventative programs. And the decision is largely, well, these are preventative, they're not emergency, the need is not there immediately, so we'll do without them. and programs that are there, such as the prenatal program. Those individuals don't receive the care they need now, and in the long run, we end up paying more as a society for that. I think here in Johnson County, we're blessed with an informed electorate, highly educated electorate, and they understand the need for these programs, but the decision now we have to make is whether we as a county step up and fund the difference. And it really presents a dilemma of how much of the burden is it fair for our own citizens to have to bear. I think they are willing to bear a reasonable portion of that, but how far we should go in that, I guess that's what we get paid to decide. But that's where I see the crunch hitting here in Johnson County.
I want an area that we haven't talked about, and I don't want to neglect it. It's waiting lists. We have waiting lists for the disabled, the developmentally disabled here in the county without services exceeds 600 that need services in developmental disabled. We have people on the physically disabled. They're on the list, the waiting lists. In the state, it's much bigger, of course. But and then we have waiting lists for even some services to the certain small groups that we tend to neglect because we want to have the biggest impact. Going through the revision of the '09 budget was something that overshadowed the first 5 weeks. And where there you saw the cut to schools, and that was because that's such a huge chunk of the budget, 52%. And so if you want to have an impact, 1% there brings a lot of money. But you had also observed that there was enhanced funding for the disabled, the physically disabled, to attempt to do away with the list, the waiting list, the physical, but we'll never be able to because people are born and have accidents and become disabled through no fault of their own, and they add to the list. So it's a matter of keeping it up. But we have a tremendous challenge there because there are individuals here from the county who were up last week, was the disabled and mentally ill visits to the Capitol, and a young man from here told me, I need services and I'm on the waiting list and I won't get them before 2013. Well, this answers an earlier inquiry of yours, Candy. You know, are we doing the best we can do? Well, making someone who's wheelchair bound and unable to be fully employed have to wait that long for a necessary service is not good. So we have some challenges.
I totally agree. We in our committee, one of our members brought to that we have hundreds of people on the waiting list for affordable housing, and you know, just one little piece of Olathe Family Lodge, 87 families are waiting. You know, so I mean, those were just some kind of a little dipstick of information, and so the need is still out there. We're always we're definitely in that. I know that you had some figures about how those kinds of how that rise has happened.
I was just wondering if I had mentioned that we're serving. Our numbers are typically run around 600 to 700 families every month that we would serve. In the last 6 months, we've seen that increase about 34%. We have gotten near 1,000 families in October and then again in December. And that's happening all while we're leveraging funds available from mainstream benefits. We are, those are the kinds of things that we need to do in terms of our due diligence anyway. That's sort of what we're an access point for SRS. Meaning that we're helping families that are eligible for those kinds of services to get signed up for those services. We help families to take advantage of programs offered by local utility companies to keep their services on during the winter months. Working collaboratively with other agencies. We work very closely with the Housing Information Center, which is the community arm of HUD, so that as we're seeing more families that come in with questions about their mortgage, how do I negotiate with my mortgage company, how do I navigate this, we're able to work with those who are specialists. We have a senior housing counselor that comes out to our office and meets with families and then is able to help us to know when can we be of the best service. we just in Johnson County, we had a 36% increase in the amount of food we distributed in the last 6 months of 2008. Utility assistance was up 15%. I mean, everything is up. Just everything is up. And that's with us, again, doing a good job of, in prescription assistance, they did something at the county called the Community Medicine Cabinet, trying to make good referrals so that while funds are available, we help folks to access those funds and leverage our ability to help. And even so, numbers are just keep going up.
We're seeing similar increases, and in addition to the numbers of people, the nature and the background of these people is changing dramatically. It's people who have never been unemployed who are now having to seek services, people who are highly educated who can't find work and need the services. So it's not just the numbers of people, it's the nature of assistance that they need that's changing quite a bit too.
And that's what I appreciated, the fact that you had talked about what kinds of things. You've already pretty well listed some of the things that someone who has never had the thought of how do I seek these kinds of services. You've given us a little bit of a list there right now. I know we only have just a very few minutes. Is there anything? I don't want anybody to think that I got an email the other day that said due to budget cuts and the rising cost of energy and electricity and gas, the light at the end of the tunnel has been turned off. I don't want anybody to think that that has happened, because here in Johnson County we have some opportunities.
Well, one area that we'll see some more help with the stimulus is in the unemployment insurance compensation. The state has hired the Department of Labor has hired 30 new persons at a time when we're cutting back temporarily, but to handle the phone calls so that people who are eligible can be put on, and then the extension by the federal government for an additional time, and then this stimulus will add some more time. So at least we'll be able to provide some income to those who are unemployed.
An hour is just not enough time to fully cover the issues of poverty, and I just cannot thank all of you enough for being so knowledgeable and so forthcoming with the information that you had. I would like to thank all of our guests for being here tonight. Valorie Carson from the United Community Services, TAMRA Brandes from Catholic Charities, Dolores Furtado from the Kansas State Representative from Kansas, and Peterson from the Johnson County Commissioners. We really appreciate your coming. We want to wish you a good evening. This program has been sponsored by the Kansas City Star, Johnson County Community College, and the League of Women Voters of Johnson County. Good evening.